All new tonight, the mother of a man with a mental health disorder is seeking some answers.
She wants to know why police officers didn't take her son to a mental health care facility. Channel 5's Angelo Vargas has the story.
We looked at all the angles in this situation. Where should law enforcement take a person with a mental health crisis? At what point does that officer make that decision? We asked and provided one concerned mother with those answers. Mental health patients require a medical clearance before being admitted into a psychiatric inpatient hospital. For Patricia Farias, the process has proven to be difficult.
I feel like I'm in the dark trying to feel my way through the system. It's been very frustrating.
Farias is just getting over a recent mental crisis from her son.
Sunday, there was a crisis at the house. Without going into detail, my son was a threat to himself, and he really scared his wife enough she felt she needed to go get a mental health detention order through a judge.
Farias says they called San Juan police to help. They wanted an officer to take her son to a mental health facility like the Tropical Texas Behavioral Health Primary Care Clinic. That didn't happen.
They kept saying that no, they couldn't do that. They kept telling my daughter, no, well, we can't take him over there directly. They have to call someone in.
We reached out to San Juan Police Chief Juan Gonzalez. He couldn't speak on the specific case. Gonzalez explains their protocol. He says they take extra precaution if a person is not considered sober.
That if they're under the influence, they will get transported to the hospital to get medically cleared before we transport them to tropical behavior so it can be evaluated.
Tropical Texas Behavioral Health Community Relations Coordinator Raquel Rosales says officers have two options. One is to have someone go to their home and screen a client. The second option is the officer can take someone to the clinic to get screened and medically cleared.
In order to utilize our primary care clinic, it would have to be our mobile crisis outreach team who has been activated to go out and assess that individual and determine the level of need and if they need to be hospitalized or not. So the medical clearance is usually required before a patient is admitted to inpatient psychiatric.
Rosales says by taking mental health clients to their facility, it could give the officer more time to get back on the streets.
That would really avoid a long wait time at an ER.
Gonzalez explains the department works with Tropical and each police department has their own protocol.
That's where I feel there needs to be more education about what's available out there and the process to go through.
Farias hopes the information gets out to the people who need it. Rosales says you do not have to be a member of the Tropical Texas Behavioral Health System to get assistance. She explains if you know someone going through a mental health issue and it's not a medical emergency, call the mobile crisis hotline number at 1-877-289-7199. In the Channel 5 News studio, Angelo Vargas, Channel 5 News at 6.